right, so now we're done with bone tissues. Now we can actually get to bone marking. So now we're in classification. So this is the way I like to think about it. And so things like bumps versus holes and grooves. That's why I have it in quotes. Do not use this on any of your further classes. Do not use this in nursing school. Do not use this in any advanced A&P courses. This is how I roughly group bone markings into categories, and I like to think of it why, because whether it's a bump or something that's raised or something that's actually some sort of indentation or some sort of hole, that often gives a clue as to its function. So by kind of like projections, so these are things that poke out. That's what I mean by a bump. And then you have things that are depressions. There's something that's sunk in or opening. Sometimes they might be a hole or there might be a little furrow in something. So that's why I talk about bumps versus holes and grooves. Now, why do I group them into these categories? Because they have general properties and they lend their properties to things like how they work with other tissues in your body. So things with projections, anything that's kind of raised on a bone surface, this allows other tissues to grab onto a bone, such as a ligament, a tendon. So these are not, so again, this is like what a projection, one thing, so things, tendons and ligaments, or instead of actually having a tissue attached to them, they might fit into a depression. So what we have here is that here we have a projection, but it kind of nestles and forms a joint with another type of bone. So projections, most projections do one of these things. They either allow something to attach to it or they fit into something. Now, on the other hand, we have depressions, right? So if projections fit into depressions, then depressions also fit projections. So if you have something raised, that's one reason you might have a little hole or furrow in a bone, is that maybe something fits into it. Or sometimes they form around things. Thing is that your bones, your tissues of your body, you need to run nerves, you need to run lymphatic capillaries and vessels, you need to run blood vessels as well. So many things in your body need to be connected to each other via tubing or nerves or other things. So sometimes you have to build a little passageway around these so you don't block off those supplies. So things, or sometimes like organs, like your brain. Thing is that you're not going to have a solid bone in your skull, right? You need room for your brain, but you also want to kind of protect it as well. So that's why you kind of have these shallow depressions forming around your brain that make up your cranium. Or sometimes they form passages through bones. Again, these passages and holes, they allow something squishy and soft to run through them, but while also protecting them. So things like blood vessels, arteries, veins, or even nerves. Some of them actually have their own holes and openings that run through the skull as well and run through the surface or the inside of the skull. So this is why I like to kind of think of those as two categories. They're not official categories, but when I first was learning bone markings, this is how I kind of organized this in my brain. Or even air. So actually, we're going to cover an example of that as well. So bone markings, so again, the thing is that it's not just about the type of projections, but also the texture of the bone as well. So here we have a smooth concrete wall, and here we have a rock climbing wall. And here we have two rock climbers. Who's going to reach the top of their wall first? The one with the very smooth wall on the left, or the one with all the handholds here on the right? The one with the textured, right? So the one with the textured, surface, they're going to have an easy time grabbing onto things and climbing up. Whereas this one on the left with the smooth surface, well, you can try to get a grip on something, but she's going to just slide right off. So bone surfaces, some are smooth, some are rough. When you have a rough surface on a bone, that means something is trying to grab onto it. It's rough for a reason because, again, if you have something like, say, a tendon that runs over it or you have a muscle attaching to it, you want some sort of texture so that something can actually attach to it. But if you want something to glide and glide across the surface of a bone, maybe you want that surface to be smooth instead of rough. Because again, if it's rough, it's going to be like sandpaper. So again, you have both smooth and rough surfaces on bone. But the thing is, like, you want something to have friction and some sort of contact and grabbing onto something, or do you want things to glide straight off? So textures and projections and smooth surfaces. So bone marking, this is from Martini, and it kind of summarized these markings in general. I'll cover a few. You should know all the ones in this list, but I'll cover some of the ones that might be new vocabulary for you. So foramen. So who's the lead boss at a construction site? What do you call that person? You call them a foreman, right? Or foreperson. But for the sake of this mnemonic, let's call them a foreman. So foreman is the person who just dictates the construction at a site, right? So this foreman is telling you to dig a hole. So this is the way I think about it. Foramen is some sort of hole in a bone. Or there's another cool mnemonic. You can think of foreman in a hole. So again, foramen is just an anatomical term for some sort of bone marking where there's a hole in a bone. So here we have the foramen magnum. So magnum means very big. So this is a big hole in the skull right here, right? In the occipital bone. And then you also have foramen in your vertebrae. So this is taking the vertebrae of your spinal column and looking at them from the top. And you have a little hole. And remember, holes, something runs through them, right? So this is why I like to think of those general properties like raised projections and bumps versus holes. If holes run something through them, hey, something like the spinal cord, which is delicate tissue, very important for your nervous system, but it's also not able. So these foramen not only allow the spinal cord to run through your bones, but also by being encased in bone, it forms a layer of protection as well. All right, so these people are in the blank of thinking. They're in the process of thinking. So kind of tap your head. Why am I asking you to tap your head? Well, a process is something on a bone that sticks out. This is why you have something sticking out, poking your head. So this is why I like to use that kind of thing. The process is something that juts out from a bone. It's a process. It pokes out. And this one's very interesting in the anatomy lab. So this is what we call the styloid process. And back to like the days of the 3DS and Nintendo. So what do you call this? You call it a stylus, right? So I think like it goes back to ancient times when, was it the Sumerians or Mesopotamians? They had used the stylus to write. But we know about this more like, okay, if we have a stylus on our 3DS, that's the little pointy thing. That's why we call it the styloid process, because it's that little sort of pointy thing that sticks out. So again, a process is something that sticks out. And what do you call the very top of a wave? Or actually, let me turn off. Let's see. So let's ask the chat. What do you call the very top of a wave? This part right here. Awesome. Yeah. So glad a lot of you know your earth sciences. So yeah, you call the top of a wave a crest, right? So like the top of a wave is a crest. Same with the iliac crest right here. So here's the ilium, and then notice that the very top of it is called the crest. So this is how I know crest, simple, like just like the wave crest. Now, what do you call this part of a book? Actually, I gave it away. Yeah, so you call it a spine. So things that it's kind of thick, it's kind of prominent, it is some sort of projection, right? So this is a big hint as to what it does. It's something that to grab onto and attach to. So many things attach to the spines you see here in the pelvic girdle, but also on your scapulae, aka your shoulder blades. So again, this is why you have these projections. Now, all of these together, so these are tubers, things like potatoes, taro, or kalo, or yam, or sweet potatoes as well. So there are 3 types of projections, and they might, if you haven't had anatomy, they're probably new words for you, but these are tubers. So I like to think of this. A tubercle is a tuber that's the size of a coal. It's a very small lump. So this is the thing, is a tubercle is just a small bump on a bone. So think of it as just a small tuber on the bone. Now, thing is that what if you have a bunch of tubers that get together? A lot of tubers getting together, it's going to form a bigger mass, and eventually they form a tuberosity. In fact, what's a bigger bump? A tuberosity. I know. So what's bigger than a coal? You have a city is bigger than a coal, so tuberosity is bigger than a tubercle. Now, thing is that, so what would make sense if you have the biggest type of tubercle? Like, what do you call a biggest type of projection? Well, it would make sense to call it something like a tuber magnum, tuber ginormous, tuber big, tuber enormous, tuber gargantuan. Unfortunately, that doesn't work. So I really had to come up with some sort of weird sort of mnemonic. So here's a big, what's bigger than a city? A mountain is bigger than the city. So on this mountain, we have this woman going up here, and she's not just any old woman, she's a very good chanter. She gets to the top of the mountain, she takes one of the tubers and throws it off the mountain. So what is he doing? She's a tro-chanter. That's why the way. So the thing is that tubercles are smallest thing compared tubercle, tuberosity, and trochanter. So trochanter is the largest. Again, a mountain is bigger than a city. Tuberosities are bigger than tubercles. Again, a city is bigger than a coal. That's how I memorize their relative sizes. So tubercle smallest. When you have a bunch of tubers together, they form a tuberosity. When you have a mountain of tubers, you have a trochanter. All right, so this is an example. So here we have the humerus in your upper arm and your femur. So again, tubercles, these are the smallest bumps, and then tuberosities, they're a little more prominent bumps, again, bigger than tubercles. And then trochanters, at least in humans, you only find them in the femur. And these are the biggest type of bumps. So again, this is where anatomists got a little, and it's like, I don't know why they didn't call it a tubercanter or something. They would just want to throw a curveball at us. But yeah, I mean, if I could rename them, I'd say small, medium, large bump. But they want to be fancy like that. So this is what we have to work with. All right, so fossa. So again, notice that it's very smooth on the inside of your skull. And why is that? Well, you don't want the inside to be rough, right? Because otherwise then your brain would be grading against sandpaper if there's any movement inside your skull. So fossa is some sort of shallow and smooth depression in the bone. So I like to think of this very gothic sink right here. So notice that this is a faucet, and it's going into a very smooth, shallow depression right here. So this is what a fossa is. It's some sort of smooth surface in the bone that forms a gently sloping gently sloping smooth surface. All right, so what expression is she doing? Or what is she doing? Starts with an S. She's throwing a tantrum, and now she's pouting, and yeah, so she's sulking, yeah? So what happens when you sulk? When you sulk, you kind of form all these like little lines in your eye, in your face, right? So sulcus is some sort of small, shallow line. So whenever, and that, actually this term appears also not only in bone anatomy, but other parts of anatomy as well, especially in the brain. So a sulcus is some sort of small, shallow furrow. It's not a very deep furrow, but it's more like a shallow side of a furrow. So again, when you sulk, you have all these little shallow lines in your face, so sulcus. And then, oh, so this is funny. So this is your friend Connie. And she's let's say she's very unique. So Connie, she's very afraid of catching Miss Rona, and she's so germophobic. So what she does, whenever she uses her phone, she actually doesn't use her fingers because, again, she doesn't want to catch Miss Rona, right? She actually dials her phone, and when she dials her phone, she uses her knuckles. So when she dials her phone, she uses her knuckles to dial her phone. But why does Connie use her knuckles to dial a phone? Well, the thing is that when you have a condyle, I know that's bad, but the condyle, so a condyle is some sort of knuckle. So it comes from the Greek word condylos. So as you can see, the condyles of the femur, they kind of look like your knuckles, right? They're kind of smooth, they're kind of raised, but this is what we have here. So condyle is a knuckle-like projection on a bone. And yeah, so it's like, this is one of the hardest things when first memorizing and learning this. You're like, there are all sorts of bumps, but why do we have all these different names? Well, again, we didn't discover these or name these, so that's just what we have to work with. All of these different terms of describing different smooth surfaces, depressions, bumps. So that's why I kind of like start general, and then I start memorizing the more specifics. All right, so when you have facets, well, if you've seen a gemstone, you notice that all these smooth parts on the gemstone, these are called facets. So similar like to bones. So these are smooth surfaces, and facets are smooth, kind of like typically flat areas that are meant for gliding. So they're smooth surfaces. That's what we're talking about with facets. So some sort of smooth side on a bone. And then meatus. So what is a meatus? So this is one of the other kind of like confusing terms. When you think meat, you think of something that's very solid, right? But or when you think of something meaty, but meatus is actually a passageway. So actually, another past student taught me this mnemonic. I liked it. So it's basically what we have here is an external auditory meatus. So this is again forming some sort of passageway, and it's allowing air to go from your outer ear and then vibrate your tympanic membrane in your just before your inner ear. So this is the mnemonic. They told me meet us in the hallway. So meatus is some sort of like passageway that connects two areas. So meatus is a passageway. And then you have, okay, so this is Venice, and and I don't have all like those fake pictures of like or post-COVID and when it's, but yeah, this is pre-COVID. So this is Venice and has a lot of canals, and all these canals connect areas as well. So when you have canal, it is some sort of depression and or sometimes a little passageway that connects two areas. So it's like, yeah, meatus versus canal. It just depends who named it first. Again, this is what we have to work with. It's some sort of passageway. And then fissure. So here we have fissures in the ground. So when you have a fissure in the skull, compared to a sulcus or other passageway, it's more jagged. It's also larger and deeper as well. So when you have a fissure, compared to something like a sulcus, it tends to be larger and wider and also deeper. So again, you have many terms and markings, and I didn't cover all of them here, but again, if I kind of help you to know some of these, the rest you can kind of just memorize and knock out on your own time. Okay, so let's go back to top hat. So foramen is a type of, okay, let's see how everybody did. And most of you said hole, and most of you are correct. Again, foramen is some sort of hole and passageway, and especially for things like if only a small thing like a blood vessel and nerve is running through it, that's why you might find a lot of foramen, like your skull has a lot of these foramen. Which of these are raised projections? So something that pokes out. Okay, let's see how everyone did. So this is the spread of responses we got. And let's see which ones are correct. And don't worry, I'll walk you through. So yes, condyle is correct. Remember, a condyle is that knuckle-like projection. A facet, so again, it's not really a projection. It's more of a smooth side of a bone, just like a facet is a smooth side of a gemstone. A fossa, again, this is more of like a shallow depression that's very smooth in a bone. Process, yeah, those are the ones that stick out, right? Process of thinking. Processes stick out just like that styloid process. A sulcus is not a projection. It's, remember, a small little shallow furrow. It's some sort of groove. And tubercle, yeah, of tubercle, tuberosity, and trochanter. Tubercles are the smallest sort of bump. Even though they're small, there's still some sort of raised projection. Okay, next question. Which of these markings are openings or passages in bones? There might be one, there might be multiple. Select all that apply. Okay, let's see how everyone did. So these are the responses, and let's see which ones are correct. So the first three answers are correct. So again, a canal is a passageway, just like the canals of Venice are passageway through Venice. A fissure, so compared to a sulcus, this is the deeper one that's also wider, so it is some sort of opening and passage. A meatus, again, another passage like your external acoustic meatus, a passageway from your outer ear into your middle ear. And then you have the process, that is not opening or passage. Again, process sticks out. A spine, that's a raised ridge. So again, it's not opening or passage. And then you have your trochanter. That's the biggest type of that rough bump. And again, if you have some sort of bump, like that's why the trochanter is very prominent. Many things attached to those trochanters.